Okay. What I think I might do, because we have so few people here, is I might just take you through what's in the packet and what I dreamed we would do as a much more comprehensive group today, and then let you all go and know that maybe we can do that at our meeting next month or some portion of that. But there's a lot of content in there that might be of interest or might not be at all. And I want to just say to Juliet, before we hop off this call, I'd love to look at yours and then with Katie and myself and see if we could set up a meeting between the three of us just to sort of mind meld on what that transportation thing looks like post-August. Okay. So we'll do that at the end once we've gotten everybody else off. Hi, Abby. Good to see you here.
Hi.
All right. I'm going to quickly show my screen, quickly go through what's here, and then say thank you all for getting on this call and let you all go so that you can do all of the things that you're trying to do at the same time. Sharing my screen. Did everybody get the packet? Maybe more importantly, can you even see the links in the chat, or do I need to paste them there again?
I see the links.
Oh, good.
I think you I think you need to paste them again. I think maybe
okay, not everybody can see
or
them.
not by the time I joined.
Okay.
Karen was nice and on time.
Please hold. Sorry, let me unshare my screen and do that really quick. There you go. Now can folks see them?
Yes, thank you.
Perfect. Okay, so this morning, and this actually would be helpful if you guys could just put your name and affiliation in the chat box. That's how I can show HRSA. These are the people that were there. Besides just directing them to the video link and saying, well, watch and see. You can tell who's there. One of the big things, or kind of the big thing that I wanted to look at together as the greater group, not just the folks that are here, is the initiative that we've just done around community conversations that are exploring stigma, and have amongst this group a conversation that debriefs about them, looks at some of the highlights that came out of those conversations, and explores how we take this initiative to go forward. And so what you'll see there in support of the conversation that I wanted to have, and the conversation is sort of looking at how can we apply what we learned at this to the community work we're all doing individually in our own organizations, as well as what challenges we might face in addressing whatever we saw out there as we were having these conversations, and then to explore why it's important to continue having the conversations and what our next steps might be. So that is the framework of what we would be discussing if we were actually discussing it today. The support for all of that, and know that this summary of the next few slides, it's like think of it as a white paper on a community doing stigma conversations. And it will also completely support the final report that I have to write for this grant at the end. And one of the things you have to do is kind of write a story about a success that you had using this grant funding. And I'm going to use this, what I've built here, as the support for that story. But what you do see, and I'll just give you a quick overview, on slide 4, I've got an overview of the Darrington's conversation. Now remember, with Tedra, her conversation was set based on the same framework everywhere we went. But of course, the conversation was different because different people showed up at each one of them. So one of the things I did for each of our conversations was to go through and summarize kind of what were the themes that were coming out of each one of those conversations. So you'll see the list of Darrington's focuses as we went through that same conversational framework. If you click the link to the attendees, you'll see who attended, and we did have great attendance in Darrington. And then if you flip over to Sky Valley, while our conversations had similar, similar themes, they actually were quite different between these two groups. And again, here on slide 5, you get a list of the attendees that were at that conference. And then One of the things that I've also attached here is an article by Sydney Jackson that was in the Herald. And when we have the whole group together and we actually do the conversation that I dreamed we might have at this meeting, we can talk a little bit about that and how that got our message out there and how we could get it out there even better going forward. And I want to stop for a second and acknowledge that Tracy just jumped on. Tracy, thank you for being here.
Oh, thanks for having me. Sorry I was late.
No worries.
All of a sudden it's like, oh, it's 11 o'clock.
Oh my goodness. Go ahead and put your name and affiliation in the chat, just so I have that record that you were here. What I'm telling folks, I'm skimming through the meeting packet for today because we have so many of us that are over at the Region 10 Opioid Summit here Thursday and Friday. What I decided to do was just take everything that I prepared for this meeting, give you guys a quick overview, and allow you to go and get on with your day. And we will actually come back and do the action, the discussion that I planned for this meeting, possibly at our next meeting. So it's going to be short. That's the net on that one.
Okay.
In both places we did the conversation. You remember she talked about the dominoes and the various, and everybody talked in small groups about the various perception, bias, prejudice, and stigma. And so that's just summarized there, and that's more for this final report that I'm writing for HRSA. And then there were some themes that came out of both of these that I wanted to give a quick overview of what they were, just because I think that they are conversations that could well happen in our future community conversations. I wanted to show sort of the flow of how it went. And then I also wanted to encourage us to be aware that at any communication, I think it's really valuable to plan to have a medical, a doctor, somebody who can speak with gravitas and credibility around some of these questions that come up. So hi, Jacob. Good to see you. It's gonna be a short one. I'll come back around to you, but it's gonna be short today. So in this, you just see sort of the flow of how that conversation unfolded. I think this one was in Darrington. And then the next slide kind of gives some of the takeaways. And one of the reasons I detailed these out is because I think as we talk about our future communications with the way we interact with our community, the way we do trainings, there might be things that we have learned about what the community is interested, or maybe if given a chance to have a conversation, these are the sorts of questions that they would ask. So maybe it's the kind of education that we can incorporate in what we're doing as we go out to them outside of these community conversations. And then there was a conversation in Darrington that was a good one, talking about recovery while hanging out at the local bar, and sort of a perspective that one participant brought that that's not possible. And then another perspective was, but these are my friends and I don't find my friends, I need my friends. So there was a nice flow of conversation there, and what could have been two perspectives going back to the corners with their own perspectives, and no chance to sort of hold both, be big enough to hold both of those perspectives. I think that was one of the big wins in that particular conversation, that we were able to sort of talk about how you could hold both of those. So that is detailed out in slide 9, and then some of those takeaways from that specific theme of conversation is highlighted here on slide 10. The question is, Matt, replacing one addiction for another was another theme that we had. So same sort of thing, give the details of sort of how that conversation flowed, and then some of the takeaways that we might sort of boil it down to. And I'm trying to think. Oh, so that was all that we did around community conversations. When we, and Jacob, because you've just gotten on, we are just quickly going through what we were going to do and discuss today, because we have so many folks at the Region 10 Opioid Conference. So I thought we'd just give you guys a preview of what we dream of talking about and the content that we've kind of prepared just to help us have that conversation from a substantive place. But we'll actually have the conversation probably at the next meeting. So I've gone through the two community conversations that we had and brought some themes out from those that were interesting. And then, and now I'm moving on to the train the trainer conversation. It's hard to summarize the trainer. You kind of need to just take it, but there is some themes that I tried to pull out of there, and also want to share with everybody that there is going to be a virtual version of the train the trainer that we're going to be able to, if we wanted to in the future, train up more folks. I am a full believer that it's much easier to go to the training once you have actually seen a conversation or two unfold. So we can talk about how to take that forward the next time we meet. So those are some takeaways that you see on slide 13. And then for future train the trainer, these are just some basics facilitating sorts of things that I think she highlighted well in her conversation when Tedra was giving that training. On slide 15, we're moving entirely on from the community stigma conversation. This slide is just an overview of an update that I gave yesterday at the MAC prevention group. But there are some things in here that might be of interest, and that as a table of stakeholders in a rural, representing the rural perspective, it might be worth thinking about. So the MAC's prevention work group is a subgroup of the whole MAC group effort, and the MAC group is the entity that's anchoring the county-wide effort for the opioid settlement funds. And so Juliet leads the prevention group, and that's how I even got invited. So thank you, Juliet. So you'll see notes from what they talked about last time. My goal back in April was to sort of present the fact that we really wanted to have a rural perspective at that table, and able to not just give perspective, but also to think about how we weave together things that are being decided at that table out in our rural areas to make sure it's effective. There is a mind map of all of the goals that if you click to that link of all the goals for that group and some of the work that they were doing. And I confess it's really only updated and probably only from my perspective because I was the one building that map. It's only updated through May of 2024 for that group. Also, we talked a little bit about naloxone and the excitement that Darrington is receiving naloxone in that community, and Tracy's done an awesome job of sort of starting to seed the idea of training, and they've done one training up there, and I think there are going to be future ones. And when we do, everybody go around the table and update, Tracy may have some input that she can give us then. On the addressing stigma, I don't know if any of you went to the MAC group, the main group that happened. I can't remember what month it happened. Was it June or May, maybe? Maybe May. So a couple months ago, maybe May.
Right.
But they introduced a SIMS model there, which is a wonderful model. And it comes kind of from the perspective of the work that you would do as you're encountering folks who are somewhere on the flow of interacting with justice and law enforcement. And what is interesting is while the opioid settlement funds are meant for a range from prevention through recovery, and they have a list of abatement strategies that there is a link to here at the Washington MOU's approved opioid abatement strategies. The prevention ones begin on page 5. So where I'm connecting you to is I don't think that the SIMS model really covers the realm of prevention stuff that we're talking about. And I would want to, if I'm a rural person representing you guys at this rural table, I would want to make sure that we explore how we go beyond the SIMS model to do the full spectrum of whatever we can do with that opioid settlement fund. And so there is the SIMS model that was sent out by the MAC group. That's in this first link. And then there is a bit of a white paper that I did that just looks at that Sims model and all of the wonder of it, and then looks beyond it to what is it that we might want to do beyond that, and why would it be valuable? So that's what's in that document. Yeah, and this strategies, I think that I included those just so that you can see that it is an intention of the opioid settlement funds that they address everything in that spectrum from prevention to recovery. Little question about funding for emergency boxes. I think that has been sorted pretty much. We know where we're going to get funding from, even if it's not the opioid settlement funds. And then a kind of bold thing that I don't think I would have gotten away with doing maybe if I was actually in an organization, but because I'm on the outside, sort of looking objectively at what we would like to do from a rural perspective, I gave an overview of a role that it seems like might be useful in the county. And honestly, not just for rural, but for the entire county, where they have an anchor that facilitates the integration of all of these efforts that are happening around addressing opioid, the impact of opioids, the recovery, prevention, treatment, and recovery. There needs to be a role that would work closely with all of the relevant stakeholders. I'm thinking rurally, but I think it probably goes beyond rural. It could go to urban as well, where it's not just that you're holding a table open, you're actually getting to know those different siloed agencies and efforts and wondrous amount of energy that people have to address this very large challenge, and works very intentionally to understand agency's perspective, agency's priorities, understands the variety of fundings that there are available and how we might weave and braid them together to do things in a collective manner that we are not capable of doing in an individual manner. But in order to do that, you really need to have an informed, engaged, at least one resource, maybe more than that, who can weave between all of those different players and actually make sure that you've done an assessment that includes everybody's perspective. You've created, priority based on everybody's perspective, and then you've created an action plan. And then you're executing it, and then you're debriefing on how did that go. And that is different than just holding a table open and asking everybody to report what did you do. So what you see in the link there is a link to why that job description would be valuable in the county. And that's all I presented at that meeting. The transportation pilot program in Sky Valley is going. Thanks so much to Ideal Options and their subcontractor Courage to Change. It's one thing to say that it's going, and it's another thing to actually ensure that the uptake of it is working and effective, and that we're learning from whatever it is that we've tried. And right now it's only going for 2 days, so there's some work to do there, but it is exciting that contract is approved. We have a van, we have a driver, we have 2 days that it's out there. So it's not just a seed now, it's a seedling. Now we've got to grow it into a full plant. And that takes me to, if I come back up here, I am interested in quickly going around any updates, wins, needs, insights from you guys that you would like to share with this group before I let you go. And I'll start with Juliet, because you're at the left of my screen.
That's fine. I'm just slow at finding my unmute button today. I'm sure I have more wins than my brain is going to recall quickly, but one is that it looks like we are able to use our overdose data to action grant funding to purchase a few naloxone like boxes or like kiosk things, which are just like free naloxone distribution spots. I'm not describing this well. There are some that we are going to purchase that basically look like the little like newspaper, the old little things you could just grab a newspaper out of. We're hoping to purchase 3 of those and have one in Darrington, one in the Sky Valley area, and then one in a more urban Everett location. So we are working, it is on my to-do list to get those ordered and figure out the logistics for keeping them stocked and restocked and kind of tracking how much Narcan is going out. But we are excited to get to use our newer funding to support a little bit of HRSA work.
That is exciting. Abby, it might be Abby and I, I'm hoping it's Abby and I are going to be in Darrington on Wednesday, and we have secured a slot with Ashley to talk with her about sort of the realities. Okay, so we want to do this now. Who do we need to get on board, et cetera, et cetera.
Perfect.
How about Tracy? Anything going on there? Well, I know there's stuff going on there.
Oh yeah, summertime's always crazy at a school district, believe it or not. But I need to talk with Amy Wheat, I believe,
Yes.
about doing another training for staff. That's on my to-do list, so I'd
Great.
like her to do one with staff and then also look at her schedule and then offer another one for the community in early September.
Oh, that's great. That's really good.
And I'm wondering, we have a back to school barbecue on August 28th
Mm-hmm.
at the elementary school. And so if there's any organizations that want to have a table, a booth to share information, you're welcome to join us at 5:30. It runs from 5:30 to 7. We serve hot dogs and hamburgers, and the kids get to meet their teacher, and a lot of parents and community members come to that event.
That's exciting. Yeah. I can't believe how
The
quickly.
first time we're doing it before school starts, so we'll see how it goes, but yeah, 5:30 to 7 on the 28th.
August 28th. Okay, excellent. And thanks so much, Tracy, for being at the community conversation. It was not only
was
was it wonderful to
interesting.
have you there as Tracy, it was wonderful to have you there as the school superintendent. And I just feel really lucky you were able to fit that into your schedule.
I enjoyed the conversations.
Excellent. Other thoughts? All right.
I think we need to continue to have those conversations.
Hear, hear. And thank you for saying it out loud. Hear, hear. Sometimes I feel like I'm the only one talking to it. We need to
Well,
have
it's-
these.
Because I have my perspective on life, and it's just important that we continue to hear other people's stories and their viewpoints and realize that, we all have a different perspective, and we need to be open to those perspectives and learn from each other, not point fingers or belittle each other because we have different opinions or different perspectives, but just learn and grow together through those conversations.
Yeah, I feel like Darrington was definitely one of those. Looking forward to having more.
Mhm.
Okay, Jacob, what's going on in your corner of the world?
Well, we have lots going on. I don't know. I'll just share. I can just
Sure.
just so we just got our first box of Narcan that is to distribute to non-clients. So I'm pretty excited about that. So we have about 100 available to us potentially a month, and so we just got our first box of that. There's some data requirements to use this, and we can't give it to our own people, our own clients. So that's interesting, but basically we'll give it out to our staff who can document and distribute once I figure that system out.
Was that naloxone you had to buy, or did it come through grant funding?
It came through, I think, like the HCA. Like
Right.
I didn't buy it. It's like distributed to me, and then
Is it the Revive or Riva? I don't know how you say that. The RIVIV kind or the other kind?
Oh, like the Narcan?
Yeah. I love these guys right there.
This one has, so I must be getting another box for the injectables. This is the nasal spray.
Oh, good. Okay.
So it's
And it
not the Revive. It looks like, I don't know,
Nice.
generic nasal spray stuff. And then there's some events happening in Monroe, probably a lot more than I know about, but the two that stand out to me are the National Night Out, which I think is August 6th. And that's typically a pretty big event for Monroe. It's run by the Rotary,
Okay.
and And yeah, they do a really good job. It's massive. Everyone comes to that. And then it's only like a 3-hour event. So there's just like a lot of people there in that time.
Like, is it 3 hours in the afternoon, evening?
Yeah, it's like, I want to say it's like 4 to 7 or something like that. Yeah,
Something
but
like
it's,
that. Mhm.
yeah. And then there's the fair days, like parade, which is fun to be a part of. We'll drive our AOT mobile, so
Uh-huh.
our vehicle that we have for the assisted outpatient treatment. We'll drive that in the parade, but that'll be a fun event that's more specific to this rural kind of area.
Uh-huh.
Even though Monroe technically isn't in it, it's everywhere surrounding Monroe is, I think.
Okay.
All right, and then some other things we've just been like we have a lot of projects, which like the AOT project. We have a new project in Everett called Emote, so it's more like our first attempt at like street psychiatry. So we're doing that in Everett, and I hope to bring some of that this way too, if we can make it work. We have some like promising potential collaborations with fire EMS locally in Snohomish County, and possibly a promising have you heard like the health engagement hubs thing going on?
Yeah, I heard. Tell us.
So I don't, there was we submitted for that with, well, I didn't really do much, honestly. That was Sound Pathways. But we're partnered with Sound Pathways to submit a grant, and they had a meeting yesterday with some clarifying questions, and it sounded pretty promising in that sense of probably going to go with us. I don't know if anybody else applied. That's how I've gotten some grants, is that nobody else applied. So it's good to apply to grants.
Do you have like a 3-sentence, this is what a health hub is?
So it's called a health engagement hub. They're piloting this right now in Washington, and they're essentially like a truly wraparound service for people with substance use disorder. So substance use treatment, mental health treatment, psychiatry, primary care, harm reduction is all done.
Dental?
One space. I don't know that dental is
Okay.
required. There are some things that we wouldn't be necessarily required to do. We just need to figure out the logistics of how to provide those things. But as far as the primary care, that would probably become a book of business for us. And then mental health, substance use, we've already been doing for a while. And then Sound Pathways is really the one that we're partnering with them to do the harm reduction piece of that. So that's pretty exciting. And then you guys have all heard of Sublocade, I'm sure,
Yes.
at this point. So Sublocade's awesome, or Brixadi, both are good for, so we've done a lot of that at our clinic here. I've been doing the injections myself for about 1.5 years, but we've started to collaborate with Safeway. So Safeway, Albertsons, that whole group, they're training all their pharmacists to administer Sublocade.
Mhm.
So if there's places like, because this covers Darrington too, right?
Yes, this table does.
Which
And
group?
what I wanted to say quickly before you go deeper is say what Sublocade is and why it's
So Sublocade's it's a long-acting injectable buprenorphine product. So
and buprenorphine is for
opiate use disorder. Yeah.
yes.
Yeah.
So it inhibits the
Yeah. So buprenorphine is a partial opioid agonist to the opiate receptor. So you have methadone, which is a full agonist. You have buprenorphine as a partial agonist. You have naltrexone or Vivitrol, which is a antagonist. And a lot of people at a right dose of buprenorphine will do very well, and it's a lot less regulated and burdensome than methadone, although methadone is easier to start somebody on because you won't have risk of precipitated withdrawal, things like this. So that's kind of a breakdown of the 3 meds that we currently use for opiate use disorder. Why Sublocade or Brixadi is cool is you give that injection, and that injection happens every 28 days, but each one actually lasts for probably a couple months in their system. So they build on it, and by the time they get their second injection, they're typically done having any cravings. That's been my experience. And because it provides such a consistent blood level of buprenorphine, compared to even the oral the sublingual Suboxone does. And so, and then, you know, they don't have to take their medication every day. If they forget, it's not a big deal. If they decide to stop, they're still protected. If they decide to stop and they've had, say, 6 injections, they're actually going to test positive for buprenorphine for 6 months to a year after that last injection. So so it makes it an easier way to actually discontinue Suboxone as well. So so I've done this with plenty of people where they've been maintained on 16 milligrams of buprenorphine for 7 years, and they're like, man, I'd really love to be done with this, but I'm kind of afraid to get off. And I said, well, the best way to do this then is Sublocade, and we get them on Sublocade, 4, 5, 6 injections of that, and then we just stop. And they do really well. They do really, really well. So I would encourage, people in this group. So the reason I bring up Safeway in the rural setting is that Darrington might have a Safeway. This is my example. Like Darrington might have a Safeway. I don't actually know. They might have a Safeway, and they might not have a provider who is administering Sublocade. So it would be a potential way to get, like I could see somebody in Darrington telehealth, and then I can prescribe Sublocade, and the Safeway can give the injection. So that's another. I mean, it's a collaboration, right?
I wonder if there's a Safeway in like Arlington.
Oh yeah, there's lots. There's
okay. All right. So one way or another.
Yeah, Arlington. So we work closely with Holman Recovery Center, and so we'll prescribe Sublocade for people while they're at Holman Recovery Center, and then they'll just take them right over to the Safeway that's walking distance from them.
Can an MD prescribe it, or does
Oh yeah, no, an MD can. Yeah, yep.
I'll have to talk to our doctor about it.
Yeah, who are you with again?
I'm in Darrington.
Yeah.
Gary Showhammer.
Okay. Yeah, for sure. So and he's already prescribing buprenorphine.
Yeah, or what's the other one?
Suboxone.
Yeah.
So already prescribing Suboxone. So yeah, so if he knows that this is, so what I did is that wasn't happening a year and a half ago. So I was ordering it from Genoa Pharmacy, and they would ship it to me, and then I would administer it myself. And you could do that if you wanted to.
You'd have to, most likely, because our pharmacy up here is closed. And so, yeah, people have to go to Arlington to get some prescriptions.
Oh, there's not even a pharmacy in Darrington at all?
No, it closed.
It's Frontier.
So that would probably be the best if the patient is seeing someone at the Darrington clinic just to get the shot there. Because
what's the population of Darrington?
10,000-ish.
the whole area is pretty big, but we just couldn't keep the pharmacist left, and the wife couldn't keep it running. So
what grocery store do you have out there?
it's an IGA.
It's an
And
IGA.
they don't do prescriptions.
They don't do prescriptions. Yeah, I just would be curious, like if, it seems like potentially a Safeway or Albertsons or something like that, if there's no market, would benefit from something. But
No.
Katie has her hand up.
Yes, Katie, I'm sorry. I saw that.
No, You're good. I was just, and you might not know, I was just wondering, because that's exciting with the Safeway thing. Do you know if that's something that they're going to be rolling out like across Washington, or because I know.
Yeah, so I'll save you all the headache, because I already, I'll save you all the
Mhm.
headaches, free information. So yes, it's rolled out all over Washington. Some of the pharmacists or pharmacies, I have no clue what they're talking about. So the place that does, though, is the hub, which is in Seattle on Rainier. And basically they have to, the pharmacists administering it do have to receive training, and that training has to come from, I think, their own people.
Yeah, and I mean, they already do vaccines, so it's not out of the realm of, what they're
No,
doing.
It's not.
So
It's not at all. It's a very, very easy injection to give, to be honest. A lot easier than like Vivitrol. Vivitrol is more challenging to give. So, yeah, so what I would do is if you're, because who are you with again, Katie?
Ideal option. So we do have some in clinic, but it depends on the site and the provider, and
I know.
we've
It's
done
a
some stuff
challenge.
with Safeway.
It's
So
administratively burdensome, so which is kind of why we started to switch. Because you guys are probably the same in me, like there's not.
yeah, we have to buy it. We have to buy it and store it, which is
Are you doing that?
I don't think we're doing it with Brixadi yet. I know we're doing it with Vivitrol.
Oh, with Vivitrol, Brixadi or yeah. Well, from my understanding, it's very like there's not a business benefit to buy and bill with Medicaid for Sublocade or Brixadi at all right now, as far as I know. But that's like the best way to do it is if you can give it to the patient when they walk in your door. I mean, that's absolutely,
Yeah.
you should do that if you can. But you know, you have to be REM certified and there's all this stuff, you know?
Yeah.
And so, you know, I would encourage you to do that if you have locations where you can, but if you don't, yeah, you can just order it to Safeway, but you would order it to that hub. And then that hub would call the patient and that patient would say, oh, I want to go to this Safeway. And then they would say, that's allowed. So that's kind of the learning process we just went through is we were trying to work with the local Safeways. Nobody had a clue what we're talking about. The Sublocade rep was telling us, yeah, we talked to them last week. They said they could do it, that kind of stuff, you know. And it was just kind of ridiculous. So now we know our process, and this can be the same for you, is to just send the order to this send the order to the that hub. Tell the patient you're gonna get a call. You need to answer the phone from the Safeway, because in that conversation they're going to decide where to ship the medication to.
Okay, so is it a
shipped-
day or two
it's shipped-
process at this point?
Yeah. So probably longer than that. Honestly, it's
Okay.
probably a week for Safeway. So that's the other problem is because right now I can order. If I ordered Sublocade before like 11 o'clock on a Tuesday, I would get it on Wednesday from Genoa.
Yeah.
I would overnight it. Yeah. And so that's the thing is, you know, you could always make that decision.
But they're just rolling it out, so it might get faster. So okay,
yeah,
cool.
I
Thank
hope
you
it
so
gets
much.
fast. I hope it gets faster, but yeah, buy and bill, that's what I wanted to do, but I just could not figure out how to do that well. Yeah. So we just kept this route.
Thank you, Jacob. That was, I mean, it's just informative all the way around. It's informative. And I think it's hard to get real conversation going about this when you're sitting in your office. So I'm glad it's happening at this table. Erin, I see your hand up.
Yeah, our provider at the Monroe Clinic was looking into that as well because we were waiting for him to get his like DEA whatever number or whatever it was before we were doing Sublocade as well. And I had reached out to a couple pharmacies. Hey, can you guys be quiet? Thank you, appreciate it. And what I noticed was the issue is either A, they didn't have somebody there that was like trained to do it, and or they were just too low on staff to be able to do stuff like that. But yeah, I had reached out to like Walmart pharmacies and Safeway as well. It just seemed like it was more of a staffing issue than anything else.
I really am hoping this becomes a flow that we figure out as a realm of different stakeholders in it, because it seems like it's such a valuable medication and approach to the whole concept of, heading toward recovery.
Yeah, I would say that Safeway has not agreed to give our folks lidocaine injections prior to, and that's an issue.
Right.
Because it hurts.
Good to know.
Yeah, Sublocade hurts. Brixadi doesn't hurt as much, but Sublocade, especially that 300 milligram injection, does not feel good, and so they have not agreed to do that at this point. I hope they do.
Okay. Things to advocate for. I don't know where you advocate for that, but yeah.
I don't know. Yeah.
Okay. Continuing going around, Katie, ideal option, stuff that's going on in your corner.
Nothing particularly specific to this group. I'll let Erin do any updates for Snohomish.
Thank you, Katie. And on to Erin then. Anna and I went out and we were very productive the day we went out together a couple weeks ago.
Yeah, honestly, I was kind of thinking the same thing. I don't have a ton of updates. Same thing. I'm going to be involved with the National Night Out as well. Just trying to push this transportation program as much as possible, posting it on group pages, out in Index and Gold Bar and Sultan, and have had really like positive feedback from the community. It's always like likes and hearts. I honestly was expecting some negative, but I actually haven't gotten any. Let's
Do we have any
see.
sense of how much actual uptake we have? And
No, I think we need to reach out to Courage to Change and see what information they have on that.
and at the end of this meeting, we talked that we want to get Katie, probably you, Erin, and Juliet and myself on a call together sometime here in the next couple of weeks and talk about just how it's going, what we're going to do, you know, as August 31st hits us with the end of this current grant
Right.
in relation to that transportation thing.
Yeah.
Okay,
Okay.
so don't go away. When I say everybody go, don't go.
Okay.
Mari, what's going on in your corner of the world?
Oh, nothing, well, not much. We're just, the move is taking up a lot of time right now, so we're focusing on that, trying to get done as much as we can by Monday. And then we just got back taking our youth coalition to the CADCA Mid-Year Institute in Chicago. So that was a lot of fun. There were 15 of us total, I think 7 kids, 4 chaperones, but yeah, it was a lot of fun. The kids got some really great planning steps on how to basically kind of do what you were talking about, needs assessment, logic model, action plan. So we'll see what they're going to bring back to the community.
All right, that's great. Now, I remember that, was it Brittany, somebody that was doing a prevention campaign, maybe from public health's perspective. I just know on my work plan, I have a prevention campaign that we're supposed to be doing youth-wise that I'll need to report on by the end of August. And I'm just wondering if there's any update there or who I should be talking to get that update. Juliet, maybe you know better than any of us? Maybe not. Judging from blanks, no, we don't know, but we need to figure it out. I'll go back and look at my notes. I do know that, you know, we sent the folks to the Montana Institute and then we were going to do a follow-on, and I am unclear.
I think we were gonna connect with Brittany who's on my team,
Okay,
who's our youth commercial tobacco and cannabis prevention
okay.
grant person. And
Uh-huh.
Mari, I know you've worked with Brittany.
Yeah.
Yeah.
And one of the things that they
Lots.
they're kind of doing kind of a 2-part thing with pieces they picked up from Montana and then pieces they picked up from CADCA. It's the You Can
Uh-huh.
marijuana, so the You Can campaign, and they're also combining it with Know Your Why. So it's going to be kind of the 2 efforts, like the 2 pieces that come together and make this whole kind of really good prevention campaign.
And that will probably get released in the school year, how we think?
So that'll kick off. We're literally, just because the move is taking so long to organizing, we're going to be closed for most of August.
Mm-hmm.
And we hope to kick off August 28th at the back to school barbecue.
Oh, great. A back to school barbecue, that's when everything's happening.
It really is.
Jacob's probably gonna bring his huge thing up to. She's like, no, I'm not. A nice RV. That is a very nice RV that you guys have going there. I like it. Okay. From Department of Health, Abby and Juliet, anything in your corner that you want to share?
None super exciting. We're going to be tabling at the Evergreen State Fair. We'll probably bring some lock bottles and, you know, some education materials. And then we also have a lot of Narcan right now. I think we've got almost 500, which is really exciting. I love having that much. Want to get that out there as much as I can. So if any of y'all need some Narcan, feel free to reach out.
Great. All right.
We're also working to get more lock bags. to help lock up medication and keep the kids and little ones in our community safe. So that's something to come as well.
Great. Okay. Thank you, Abby. I think I asked everybody? Okay. So thank you so much for coming and for listening to the drone at the beginning. Really, I think that will be a good conversation with folks when we actually have more people at the table. I think I'm gonna let everybody go who isn't Juliet, Abby, Katie, Aaron. Maybe Maria and Jacob, you can go.
Okay, see ya.